Chair now recognizes Ms. Sonya Tetnowski, who is President-elect of the National Council of Urban Indian Health.
Chairwoman Fernandez, Ranking Member Young, and members of the House Natural Resources Subcommittee for Indigenous Peoples, thank you for the opportunity to testify today. I'm Sonya Tetnowski, an enrolled member of the Makah Tribe and currently the President-elect of the National Council of Urban Indian Health, which represents 41 urban Indian organizations. UIOs provide high-quality, culturally competent care to more than 70% of American Indians and Alaska Natives that reside in urban areas. As the CEO of the Indian Health Center of Santa Clara Valley and a UIO that provides comprehensive health care to nearly 24,000 patients, representing 114 different tribes, I testify today in support of the Urban Indian Health Providers Facilities Improvement Act, H.R. 3496, which will expand the use of existing Indian Health Service resources to be spent where they are needed, specifically for necessary facilities maintenance and renovation. I applaud Representatives Gallego and Representative Bacon for introducing this bill that will fix an unnecessary barrier to care and allow UIOs to make critical updates to our facilities. Specifically, this bipartisan bill corrects an oversight in Section 509 of the Indian Healthcare Improvement Act that effectively prohibits us from using our IHS funding on infrastructure and facilities improvement projects unless the project is undertaken for accreditation by the Joint Commission. TJC is no longer the accreditation body that is used among the vast majority of UIOs. 40 of the 41 do not utilize TJC accreditation. For example, at IHC, we have accreditation by the Accreditation Association of Ambulatory Healthcare, AAAHC, for more than 20 years now. AAAHC is a nationally accepted accreditation body, which IHS promotes as an accreditation option for UIOs. However, our AAAHC accreditation effectively bars IHC from utilizing IHS funds for any facilities improvements because the statute only mentions TJC, which meant that we were unable to utilize the IHS funding to make potentially life-saving facilities upgrades such as our HVAC system because we were not accredited by TJC. In other words, a health facility could not use its funding from a health agency to make air purification changes while in a global pandemic of an airborne virus, solely because of the restrictions this bill seeks to fix. At IHC, we have been forced to grapple with difficult decisions between direct patient care and facilities investments to meet the critical infrastructure needs essential to continuing to provide high-quality care to our patients. This bill would remove unnecessary limitations to our funding, immediately allowing UIOs to use our IHS funding more effectively and efficiently. Inadequate facilities and safety issues are never something I nor any other UIO want impacting our care that we give to our patients. We need this legislative fix now. In addition, this essential fix has widespread support, including within Indian country. I would add, NCUIH, the National Congress of American Indians, and the 29 other Indian organizations requested this change in an infrastructure needs letter to Congress. This bill also has extensive support among policymakers, with House Interior Appropriations, including the UIO facilities fix in fiscal year 22 appropriations bill and the President's FY22 budget. This support makes one thing clear. We must act now to pass this urgent bipartisan and no-cost legislation. We urge the members of this subcommittee to include this priority in your request to leadership for the next infrastructure package. In addition, we respectfully request a markup on the bill as soon as possible to allow the floor consideration. Finally, to demonstrate a strong showing of commitment to improving urban Indian health, we ask all members to co-sponsor H.R. 3496. Thank you again for your time and time today and for working with NCUIH to ensure Native people can receive high quality care regardless of where they live. Thank you so much for your time today.